Would you like free audiobooks? Click the link in the description. Question 1. A nurse is assessing a patient with chronic peripheral arterial disease, PAD. Which symptom would the nurse expect to find? A. Hair growth on the toes. B. Decreased capillary refill time. C. Pain relief when legs are dangled. D. Edema around the ankles and feet. Correct answer. C. Rationale: patients with PAD often experience pain due to reduced blood flow to the lower extremities. Dangling the legs off the side of the bed can help increase blood flow due to gravity, often providing temporary pain relief. A. Hair loss, not growth, is a common symptom of PAD due to poor blood flow. B. Decreased capillary refill time is not associated with PAD, prolonged refill time could be a sign. D. Edema is more commonly associated with venous insufficiency, not arterial disease. Question 2. A nurse is preparing to assess the dorsalis pedis pulse of a patient suspected of having peripheral vascular disease. Which approach is most appropriate for locating this pulse? A. Palpating just lateral to the extensor tendon of the great toe. B. Palpating behind the medial malleolus. C. Palpating the top of the foot between the first and second metatarsal. D. Palpating over the popliteal fossa. Correct answer. C. Rationale: the dorsalis pedis pulse is best palpated on the dorsum of the foot between the first and second metatarsal bones. This location is where the pulse's presence or absence provides valuable information about the peripheral arterial circulation of the foot. A. This describes a method that may not accurately locate the dorsalis pedis pulse. B. This is the location for palpating the posterior tibial pulse, not the dorsalis pedis. D. The popliteal fossa is where the popliteal pulse is palpated, not the dorsalis pedis. Question 3. Which of the following findings would a nurse interpret as a potential sign of deep vein thrombosis, DVT, in a patient's lower extremity? A. A palpable, strong popliteal pulse. B. Holman's sign, pain in the calf upon dorsiflexion of the foot. C. Coolness and pallor of the extremity. D. A decrease in leg circumference compared to the contralateral leg. Correct answer. B. Rationale: Holman's sign can indicate deep vein thrombosis, although its reliability is questioned by some experts. It's when pain occurs in the calf or popliteal region during dorsiflexion of the foot. A palpable popliteal pulse does not specifically indicate DVT. C. Coolness and pallor would more likely suggest arterial, not venous, issues. D. An increase, not a decrease, in leg circumference compared to the other leg is a common sign of DVT, indicating swelling and possible venous obstruction. Question 4. A nurse is educating a group of nursing students on the assessment of peripheral vascular diseases. The nurse explains the importance of comparing bilateral extremities for which of the following reasons? A. Unilateral changes often indicate systemic issues. B. Bilateral symmetry in findings helps confirm peripheral vascular disease. C. Differences between the limbs can indicate localized vascular problems. D. It is easier to detect changes when comparing extremities. Correct answer. C. Rationale: comparing bilateral extremities is crucial because differences between the limbs, such as swelling, color, temperature, and pulse strength, can indicate localized vascular problems like DVT, PAD, or venous insufficiency. A. Systemic issues would likely affect both limbs similarly, not unilaterally. B. Bilateral symmetry does not confirm peripheral vascular disease. Asymmetry may be more indicative of such conditions. D. While comparing extremities does make it easier to detect changes, the key rationale is identifying unilateral changes that suggest localized issues. Question 5. During an assessment, A nurse finds that a patient has an ankle brachial index of 0.7. How should the nurse interpret this finding? A. Normal, no significant arterial disease. B. Mild peripheral arterial disease. C. Moderate peripheral arterial disease. D. Severe peripheral arterial disease. Correct answer, D. Rationale: the ankle brachial index, ABI, is a non-invasive test used to check for peripheral arterial disease. ABI is calculated by dividing the systolic blood pressure at the ankle by the systolic blood pressure in the arm. An ABI of 1.0 to 1.4 is considered normal, indicating no significant arterial obstruction. An ABI of 0.7 indicates moderate to severe PAD, as it reflects a significant reduction in blood flow to the lower extremities. This can lead to symptoms such as claudication and, in severe cases, critical limb ischemia. An ABI of 1.0 to 1.4 would be considered normal. B. Mild PAD would be indicated by an ABI of 0.9 to 0.7, borderline. C. Moderate PAD is typically indicated by an ABI of 0.4 to 0.69, with 0.7 being on the cusp of mild to moderate PAD but more commonly associated with moderate disease given the clinical context. Question 6. A patient with a history of diabetes mellitus and peripheral arterial disease complains of pain in the feet that worsens at night. Which of the following actions by the nurse is most appropriate? A. Advise the patient to keep the legs elevated while sleeping. B. Recommend that the patient sleep with the legs in a dependent position. C. Suggest the application of cold compresses to the feet before bedtime. D. Encourage the patient to perform vigorous toe exercises before bed. Correct answer, B. Rationale: for patients with peripheral arterial disease, especially those with diabetes mellitus, pain at night can be a result of decreased blood flow to the lower extremities. Keeping the legs in a dependent position, e.g., dangling over the side of the bed or placing pillows under the mattress to lower the feet, can help increase blood flow through gravity assistance and may relieve pain. A. Elevating the legs would decrease arterial blood flow to the feet, potentially worsening pain. C. Cold compresses could cause vasoconstriction and worsen pain by further reducing blood flow. D. While toe exercises can help improve circulation, they are unlikely to provide immediate pain relief and might actually increase pain if performed vigorously before bed. Question 7. A nurse notes that a patient has 1+ pitting edema on the right lower leg and no edema on the left leg. The patient reports no pain but mentions the right leg often feels heavy. Which of the following conditions is the most likely cause of these findings? A. Deep vein thrombosis, DVT. B. Lymphedema. C. Chronic venous insufficiency, CVI. D. Peripheral arterial disease, PAD. Correct answer, C. Rationale: chronic venous insufficiency, CVI, is a condition characterized by poor venous return, often resulting in edema, skin changes, and a feeling of heaviness in the legs without significant pain. 1+ pitting edema and symptoms of heaviness, particularly if they are unilateral, can be indicative of CVI. A. DVT typically presents with pain, redness, and warmth in the affected leg, in addition to edema. B. Lymphedema is usually non-pitting and associated with conditions affecting lymphatic drainage. D. PAD usually presents with symptoms such as claudication, decreased pulses, and changes in skin color and temperature, rather than unilateral edema. Question 8. In teaching a patient about preventing deep vein thrombosis, DVT, during a long flight, which piece of advice should the nurse include? A. Remain seated and avoid moving for the duration of the flight. B. Consume plenty of caffeinated beverages to promote blood flow. C. Perform ankle circles and foot pumps every hour. D. Wear compression stockings that are tightest at the thigh. Correct answer. C. Rationale: performing ankle circles and foot pumps every hour during long flights can help promote venous return from the lower extremities, reducing the risk of DVT by preventing blood from pooling in the legs. A. Remaining seated and avoiding movement can actually increase the risk of DVT. B. Caffeinated beverages can lead to dehydration, which can potentially increase the risk of DVT. D. Compression stockings used to prevent DVT should be graduated, meaning they are tighter at the ankle and gradually decrease in pressure up the leg, not the other way around. Question 9. A nurse is performing a peripheral vascular assessment on a patient. Upon palpation, the nurse is unable to feel the patient's pedal pulses. What should the nurse do next? A. Immediately start the patient on anticoagulant therapy as a preventive measure for DVT. B. Document the finding and proceed with the assessment. C. Use a Doppler ultrasound device to assess the pulses. D. Notify the physician immediately about a potential arterial blockage. Correct answer, C. Rationale: when pedal pulses are not palpable, the next step is to use a Doppler ultrasound device to assess for the presence of blood flow. This non-invasive tool can detect blood flow even when pulses are too faint to be felt by palpation. This step is crucial for determining the adequacy of peripheral circulation and guiding further evaluation or intervention. A. Starting a patient on anticoagulant therapy without a specific diagnosis and indication can be harmful and is not based on the inability to palpate pulses alone. B. While documentation is important, the nurse should first attempt to assess the pulses using a Doppler before concluding the assessment. D. Notifying the physician is important, but it should be done after attempting to assess the pulses with a Doppler to provide more comprehensive information about the patient's condition. Question 10. Which assessment finding would most strongly suggest a diagnosis of lymphedema in a patient's lower extremity? A. Varicose veins visible on the affected leg. B. Pain that decreases with leg elevation. C. Non-pitting, brawny edema of the affected limb. D. A positive Homans sign. Correct answer. C. Rationale: lymphedema is characterized by non-pitting, brawny edema due to the accumulation of lymphatic fluid in the tissues, leading to swelling. This type of edema does not leave an indent when pressed, unlike the pitting edema often seen in conditions like chronic venous insufficiency or heart failure. A. Varicose veins are more commonly associated with chronic venous insufficiency. B. Pain that decreases with leg elevation is also more indicative of venous issues. D. A positive Homans sign is traditionally associated with deep vein thrombosis, not lymphedema. Question 11. A patient with peripheral arterial disease reports intermittent claudication. Which nursing intervention is most appropriate for managing this symptom? A. Encourage complete bed rest to conserve energy. B. Advise the patient to stop walking immediately when pain starts. C. Recommend a walking program that gradually increases in distance. D. Suggest high-intensity interval training to improve leg strength. Correct answer. C. Rationale: a supervised or structured walking program that gradually increases in distance or duration can help improve symptoms of intermittent claudication in patients with peripheral arterial disease. This approach promotes the development of collateral circulation, improving blood flow to the affected areas. A. Complete bed rest can lead to muscle atrophy and does not promote circulation. B. Stopping walking immediately when pain starts does not encourage the development of collateral circulation and can lead to a decrease in physical fitness. D. High-intensity interval training may be too strenuous for patients with PAD and intermittent claudication, especially in the initial stages of exercise rehabilitation. Question 12. A nurse is educating a patient with venous insufficiency about skin care. Which piece of advice is most appropriate? A. Use a heating pad on your legs to improve circulation. B. Apply moisturizer daily to prevent skin breakdown. C. Avoid elevating your legs throughout the day. D. Scratch any itchy areas vigorously to stimulate blood flow. Correct answer, B. Rationale: for patients with venous insufficiency, skin care is crucial to prevent ulcers and breakdown. Applying moisturizer daily can help maintain skin integrity and prevent cracks and dryness, which can lead to skin breakdown and infection. A. Using a heating pad directly on the legs can lead to burns and is not recommended to improve circulation. C. Elevating the legs helps reduce venous pressure and swelling, so avoiding elevation is counterproductive. D. Scratching can damage the skin, increasing the risk of infection and ulceration, especially in areas with poor circulation. Question 13. When assessing a patient for arterial insufficiency in the lower extremities, which finding would the nurse expect? A. Warm skin. B. Strong pedal pulses. C. Hair loss on the lower legs. D. Edema around the ankles and feet. Correct answer. C. Rationale: hair loss on the lower legs can be a sign of arterial insufficiency, as poor blood flow can lead to decreased oxygen and nutrients reaching the hair follicles, causing the hair to fall out. A. Warm skin is more commonly associated with venous insufficiency. Cool skin is a symptom of arterial insufficiency. B. Weak or absent pedal pulses, not strong ones, would be expected in arterial insufficiency due to the reduced blood flow to the extremities. D. While edema is common in venous insufficiency, arterial insufficiency typically does not cause significant swelling. Instead, it may lead to symptoms such as pain, coolness, and pallor in the affected limbs. Question 14. A nurse is teaching a patient with a history of deep vein thrombosis, DVT, about preventing recurrence. Which statement by the patient indicates a need for further teaching? A. I should try to move around every hour or so during long car rides. B. It's important for me to keep my legs crossed at the knees when sitting. C. Wearing compression stockings can help prevent another DVT. D. I need to stay hydrated, especially when I'm traveling. Correct answer, B. Rationale: crossing the legs at the knees can impair venous return and increase the risk of DVT, especially in individuals with a history of venous thromboembolism. This practice can compress the veins and hinder blood flow, which is crucial to avoid in patients at risk for DVT. A, C, and D are all correct statements that align with recommendations for preventing DVT recurrence, including moving regularly during prolonged periods of immobility, wearing compression stockings to improve venous return, and staying hydrated to help prevent blood from thickening and forming clots. Question 15. A nurse is assessing a patient for potential venous stasis ulcers. Which location is the most common for these ulcers to develop? A. On the heel of the foot. B. Over the shin bone. C. Around the ankle, particularly the medial side. D. On the tips of the toes. Correct answer, C. Rationale: venous stasis ulcers most commonly occur around the ankles, especially on the medial side, due to poor venous return and increased venous pressure in this area. This can lead to skin breakdown and ulcer formation. A. Heel ulcers are more commonly associated with pressure ulcers. B. Ulcers over the shin bone are less common and can be related to other conditions. D. Toe ulcers are more commonly seen in arterial insufficiency due to reduced blood flow to the extremities. Question 16. Which intervention is most effective in promoting venous return in a patient with chronic venous insufficiency? A. Advising the patient to remain standing for long periods. B. Encouraging the patient to wear tight, restrictive clothing. C. Recommending regular walking and elevation of the legs. D. Suggesting the application of heat to the affected legs. Correct answer, C. Rationale: Regular walking and elevation of the legs are effective interventions for promoting venous return in patients with chronic venous insufficiency. Walking activates the muscle pump in the legs, which helps move blood back towards the heart, while elevating the legs above the level of the heart reduces venous pressure and edema. Standing for long periods can worsen venous insufficiency by increasing venous pressure. B. Tight, restrictive clothing can impair blood flow. D. Applying heat can cause vasodilation, potentially worsening edema and venous pressure in the affected limbs. Question 17. A nurse is caring for a patient who presents with unilateral redness, warmth, and swelling of the lower leg. The nurse suspects deep vein thrombosis, DVT. Which diagnostic test does the nurse anticipate will be ordered to confirm the diagnosis? A. Venous Doppler ultrasound. B. Arterial Doppler ultrasound. C. Ankle brachial index. D. Lymphoscintigraphy. Correct answer. A. Rationale: a venous Doppler ultrasound is the most commonly used diagnostic test to confirm the presence of a deep vein thrombosis. It allows for the visualization of blood flow in the veins and can detect blockages or clots. B. An arterial Doppler ultrasound is used to assess arterial blood flow, not venous conditions like DVT. C. The ankle brachial index is used to diagnose peripheral arterial disease, not DVT. D. Lymphoscintigraphy is a diagnostic test used in the assessment of lymphedema, not DVT. Question 18. A patient with severe peripheral arterial disease has developed gangrene of the toe. Which treatment option is most likely to be recommended? A. Conservative management with antibiotics and wound care. B. Immediate initiation of anticoagulant therapy. C. Surgical revascularization or amputation. D. Application of a topical vasodilator to promote blood flow. Question 18. Correct answer, C. Rationale: in cases of severe peripheral arterial disease where gangrene of a toe has developed, conservative treatments are unlikely to be effective due to the severe reduction in blood flow and tissue death. Surgical revascularization may be attempted to restore blood flow to the affected area. However, if revascularization is not possible or the tissue damage is too extensive, amputation of the affected toe or part of the foot may be necessary to prevent the spread of infection and further tissue death. A. Antibiotics and wound care are important but may not be sufficient on their own if blood flow cannot be restored. B. Anticoagulant therapy is used to prevent blood clots, but does not address the existing lack of blood flow or tissue necrosis. D. Topical vasodilators can improve blood flow superficially but are unlikely to reverse the severe underlying arterial insufficiency or the presence of gangrene. Question 19. Which lifestyle modification should a nurse recommend to a patient diagnosed with peripheral arterial disease to help manage the condition? A. Limit physical activity to avoid leg pain. B. Increase the intake of saturated fats to raise energy levels. C. Quit smoking to improve arterial health. D. Elevate the legs above the heart for 30 minutes every day. Correct answer. C. Rationale: smoking is a major risk factor for the development and progression of peripheral arterial disease, PAD, because it contributes to arterial narrowing and decreased blood flow. Quitting smoking can significantly improve arterial health and blood flow, reducing PAD symptoms and preventing disease progression. A. Regular, moderate physical activity is actually recommended to promote collateral circulation and manage PAD symptoms. B. A diet high in saturated fats can worsen arterial health by contributing to atherosclerosis. A diet low in saturated fats and high in fruits, vegetables, and whole grains is recommended. D. While elevation can help manage swelling in venous diseases, PAD benefits more from activities that promote blood flow, such as walking. Question 20. A nurse is educating a patient on the signs and symptoms of chronic venous insufficiency, CVI. Which symptom is most characteristic of this condition? A. Intermittent claudication. B. Throbbing pain in the legs. C. Ulcers around the ankles. D. Numbness in the toes. Correct answer. C. Rationale: chronic venous insufficiency, CVI, often leads to ulcers around the ankles due to poor venous return and increased pressure in the veins, which can cause skin changes and ulceration. These ulcers are often difficult to heal and require comprehensive wound care management. A. Intermittent claudication is more characteristic of peripheral arterial disease. B. While throbbing pain can be present in CVI, it is not as specific as the presence of ulcers. D. Numbness in the toes is more indicative of neuropathy or arterial insufficiency. Question 21. During an examination, a nurse observes that a patient has shiny, tight skin on the lower legs and absence of hair. The patient also reports feeling cold in the affected limbs. What is the most likely underlying condition? A. Deep vein thrombosis. B. Peripheral arterial disease. C. Lymphedema. D. Chronic venous insufficiency, CVI. Correct answer. B. Peripheral arterial disease. Rationale: shiny, tight skin on the lower legs and absence of hair, coupled with coldness in the limbs, are classic signs of peripheral arterial disease. These symptoms occur due to reduced blood flow and oxygen to the skin and tissues, leading to changes in skin appearance, hair loss, and a decrease in skin temperature. A. DVT primarily presents with swelling, pain, and redness in the affected limb. C. Lymphedema results in swelling, but the skin is usually not described as shiny or tight, and temperature changes are not as prominent. D. CVI may lead to skin changes and ulcers, but typically does not cause hair loss or coldness in the limbs. Question 22. A nurse is providing post-operative care for a patient who had a surgical revascularization procedure for peripheral arterial disease. Which statement by the patient would indicate a potential complication of the procedure? A. I feel a pulsating sensation in the operated leg. B. My foot looks redder than usual. C. I can't feel my toes on the operated leg. D. There's a small amount of clear drainage from the incision site. Correct answer. C. I can't feel my toes on the operated leg. Rationale: a loss of sensation or inability to feel the toes on the operated leg may indicate a serious complication, such as nerve damage or inadequate blood flow to the limb following the revascularization procedure. Immediate assessment and intervention are crucial to prevent further complications, including potential limb loss. A. A pulsating sensation in the operated leg can be normal following revascularization, as it may indicate restored blood flow. B. Redness can be a sign of increased blood flow or inflammation, which is expected post-operation but should still be monitored. D. A small amount of clear drainage from the incision site can be normal in the immediate postoperative period, but should be monitored for signs of infection or increased drainage. Question 23. A patient with chronic venous insufficiency, CVI, is being instructed on how to apply compression stockings. Which instruction is most important for the nurse to emphasize? A. Apply your stockings at the end of the day for best results. B. Make sure the stockings are evenly applied without any wrinkles. C. It's okay to double up on stockings if swelling increases. D. Compression stockings are only necessary when symptoms are severe. Correct answer: B. Make sure the stockings are evenly applied without any wrinkles. Rationale: ensuring that compression stockings are applied smoothly without any wrinkles or folds is crucial to avoid constricting blood flow or causing pressure points that could lead to skin breakdown or ulcers. Proper application promotes venous return and reduces symptoms of CVI. A. Compression stockings should be applied in the morning before getting out of bed and before any significant leg swelling occurs. C. Doubling up on stockings is not recommended without healthcare provider approval, as too much compression can impede blood flow. D. Compression stockings should be worn regularly, as prescribed, not just when symptoms are severe, to manage CVI effectively and prevent complications. Question 24. A nurse is caring for a patient who recently underwent angioplasty with stent placement for peripheral arterial disease. The patient asks when they can resume exercise. What is the best response by the nurse? A. You should avoid all forms of exercise to prevent dislodging the stent. B. Light to moderate exercise, such as walking, can usually be resumed within a few days to weeks, but check with your healthcare provider first. C. You can immediately return to high-intensity workouts if you feel up to it. D. Only non-weight-bearing exercises are safe after stent placement. Correct answer. B. Light to moderate exercise, such as walking, can usually be resumed within a few days to weeks, but check with your healthcare provider first. Rationale: resuming light to moderate exercise after angioplasty and stent placement for PAD is generally beneficial and helps improve circulation and recovery. However, it's essential to get clearance from a healthcare provider to determine the appropriate timing and intensity of exercise based on the individual's condition and recovery progress. A. Avoiding all exercise is not recommended, as physical activity supports cardiovascular health. C. High-intensity workouts may be too strenuous immediately following the procedure and should be gradually introduced based on professional guidance. D. Weight-bearing exercises like walking are actually beneficial for PAD patients, promoting blood flow and vascular health, but should be approached with caution and professional advice post-procedure. Question 25. When teaching a patient about lifestyle modifications to manage peripheral arterial disease, which dietary recommendation is most appropriate? A. Increase intake of red meats for their high iron content. B. Incorporate more whole grains, fruits, and vegetables into the diet. C. Focus on a high-fat diet to increase caloric intake. D. Limit fluid intake to reduce the risk of edema. Correct answer. B. Incorporate more whole grains, fruits, and vegetables into the diet. Rationale: a diet rich in whole grains, fruits, and vegetables can help improve cardiovascular health by reducing cholesterol levels, managing blood pressure, and promoting healthy blood flow, which is especially important for patients with peripheral arterial disease, PAD. These foods are high in fiber, antioxidants, and essential nutrients, which support overall health and may help manage PAD symptoms. A. High intake of red meats, particularly those that are processed or high in saturated fats, can contribute to atherosclerosis and should be limited. C. A high-fat diet, especially in saturated and trans fats, can worsen cardiovascular health. D. Adequate hydration is important for vascular health. Limiting fluid intake unnecessarily can lead to dehydration and negatively affect blood volume and circulation. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.